These are the muscles of the pelvic floor. So for male and female, they're very, very similar muscles. It can be divided into two different triangles. This is the anterior triangle, and this is the posterior triangle. So the anterior triangle is called the urogenital, and the posterior triangle is called the anal triangle. So there's some names there. In the anterior triangle or urogenital triangle, you have two different layers. One you have superficial layer, and the other one is the deep layer. So this muscle is called Ischiocavernosus muscle, and this one is called the Bulbospongiosus muscle. These muscles contain erectile tissue. So during sexual activity, these muscles contract. It can cause erection of the clitoris, which is located around this area. Also, Bulbospongiosus cause narrowing of the vaginal opening. Outside of the sexual activity, does not have that much function. And there is another muscle here. This is called a superficial transverse perineal muscle. So this is the ischial spine, and this is the central tendon of the perineum. So this muscle is connecting those two areas. This is just for a stabilization of the pelvic floor. Here in the deep layer, you have two muscles. One is called external urethral sphincter, that is around the urethra, and here is you can consciously control the urination. So when the bladder is full, the signals are sent to the brain, and then the internal urethral sphincter muscles that are smooth muscles, they relax, but the external one is under conscious control. So initially, during a very young age, during infancy, toddler years, these muscles are not working properly, so that's why the baby urinates. But later on, it comes under conscious control, so they are normally contracted, and only when the time and the location is appropriate, then those muscles relax, and urine can come out, and urination can take place. And then is the deep transverse perineal muscle, and again, this muscle is also for stabilization of the pelvis. Then is you have the anal triangle. So here you have the levator ani that is causing elevation of the anus. This is during defecation. So there's two muscles here. One is called Pubococcygeus. So this is very deep. So starting from pubis, this is pubic bone, this area, coming all the way to here to coccyx. And this is another one is called Iliococcygeus, and this is coming from ilium all the way to the coccyx. Okay, so these two muscles are making levator ani muscle. Then is external anal sphincter. So same idea that I talked about the urethral sphincter, you have the same idea here. So you have the internal anal sphincter, which is a smooth muscle, and external one, which is the under conscious control. You also have some other muscle. One is Coccygeus. This is a pelvic floor muscle, and gluteus maximus, which is important for the movement of the hip. So we will talk about that in a few minutes. For the male pelvic floor, everything is the same thing. So there is nothing new there. These two muscles, Ischiocavernosus and Bulbospongiosus, both of them are important for erection. Also, Bulbospongiosus is wrapping around urethra, so it's important for ejection of urine and ejection of semen in men. But the rest is all the same thing.